What are your thoughts on fluoride in our water?
No one is saying if you drink 1 glass of fluoridated water, you're going to have long-term effects. There are concerns with neurotoxicity and IQ drop, and the IQ drop that was shown in the literature is on par with lead. Everyone will say dose makes the poison, but here's what they're missing.
Hello, everyone. Welcome to another episode of the Save Yourself podcast. I am so excited to have Dr. Staci Whitman here with me today. And before we dive into all of the things we want to talk about, I wanted to give you a little background of her. We're going to be talking about fluoride. We're going to be talking about nutrition and the oral health part of it. We're going to be talking about perimenopause, all the things. I'm so excited to have her here. Dr. Staci is a leading authority in functional dentistry. She's on a mission to revolutionize oral health care. She has a unique blend of scientific expertise and compassionate care, and she's dedicated to creating cavity-free world. That's cool. And she's board certified in pediatric integrative dentistry and naturopathic dentistry, and is one of the only dentists in the world to have her functional medicine certification from the Institute of Functional Medicine. She's founded one of the leading functional pediatric dental offices in the country, where she takes whole body and holistic approach to her care. And she's a co-founder of the Institute of Functional Dentistry, launching in summer 2025, and lectures globally on all of these things. You have like an amazing, huge bio, but mostly you're really into the oral microbiome, which I love, hormone health, which I love, nutrition, which I love, sleep, which I love, and airway health. And you're a big expert educator with a heavy focus on preventative dentistry, cavity arrest, and remineralization. You are creating happy teeth and happy lives. Welcome. Thank you for being here.
Thank you so much for having me. I'm very excited to unpack all the things. It can be very layered, so we can cover as much as we have time for. I'm excited for it.
All right, let's start with maybe the big controversial topic. What are your thoughts on fluoride in our water?
Yes. So, I always like to start by saying I was traditionally trained, as every dentist and every physician was, right? And so I was trained that water fluoridation and just fluoride in general is the gold standard for cavity prevention. I used to be a huge advocate for water fluoridation. In fact, I live in Portland, Oregon, where the water is not fluoridated. And the last time it was up on the ballot was in 2012, and I actually, volunteered and picketed for the pro side, and it was because in hindsight, I had never read the research, taken the time to understand any of the controversy, nor had I even heard of any of the controversy. They do not teach any of that in school, and so if you're not exposed to it, you wouldn't know what questions to ask. So I was at a debate for this ballot measure, and I was sitting on the pro side, or those that advocated for it. I don't love pro and anti language, to
Yeah.
be honest with you, but, I definitely was judging those with concern and in my mind thinking tin hat brigade, conspiracy theorists. And I sat there and I listened to the debate and I was blown away. The people who spoke were highly educated, thoughtful, genuine, research backed, and brought up all of the concerns with water fluoridation, which can include thyroid health issues, gut microbiome dysbiosis, oral microbiome dysbiosis. It's considered a neurotoxin, fluorosis of the teeth and the bone, and beyond. So I then did my due diligence and I started to unpack, and again, this was almost 15 years ago. Started to unpack some of the science, and it didn't take very long. If you take a stance that the do no harm stance, or that the burden of proof should be on the safety of something, it didn't take long for me to switch my mind and change my mind. And of course, that comes with extreme controversy. Now flash forward to current day now, and there's copious data to show that systemic fluoride ingested, and that means water fluoridation, fluoride supplements, things that we swallow, they're concerning and can be detrimental. Number one, what's important to know is fluoride works primarily topically, not systemically. And this has been shown over and over again in the data, and it's even taught in dental schools, okay? But yet we still participate in this antiquated practice. And so there was a federal trial, the TASCA trial, and it was essentially the people versus the EPA, and it was an ongoing trial for about 7 years, and so last fall, finally, the federal judge made the verdict that there's an unreasonable risk to current water fluoridation practices, and the concern is, especially during pregnancy and those first 1,000 days or those first 3 years of life in children during active brain development, there are concerns with neurotoxicity and IQ drop, and the IQ drop that was shown in the literature is on par with lead.
So crazy.
It's crazy, and so you would think at least this should give us pause, but instead what's happening is people are trying to disprove this science, okay? And these are meta-analyses, they're systematic reviews. There was the new Cochrane Collaborative that came out, which is generally considered the gold standard of reviewing medical research and data. That newer analysis of water fluoridation came out just last year in 2024, and it showed that water fluoridation is not as beneficial as we once thought. It only is reducing decay by 3%, which is about one quarter a cavity per person. But yet, you'll still see the American Dental Association and mainstream media referencing the old Cochrane Collaborative report from over 10 plus years ago, which shows 25% reduction. So if you see that stat, that is old data and it is not updated. And so a 3% reduction in cavities is not statistically significant. So, is water fluoridation even helping? And my argument would be no, and people will fight back on that. But again, we know that cavities are not from lack of fluoride. Cavities are from our diet, our nutrition, our lifestyle factors, how we're breathing, our hygiene. No one's fluoride deficient. The human body suffers from no fluoride deficiency. That's not a diagnosis. And truly, patients should have a choice, right? So our water is fluoridated, you lose autonomy, you lose consent. And we know that topical fluoride is what works. So if someone really wants to use fluoride to help reduce cavity risk, and what fluoride does topically is it makes your teeth more acid resistant. So the effects of pH changes are less damaging. Then use it topically, use it in toothpaste, use it in rinses, ideally spitting. But why are we subjecting the populace to this practice? And over 70% of the United States is fluoridated currently, and it's unfair to expect people to have to purchase reverse osmosis filters, if they choose not to have fluoride in their water to remove it, and then, some will argue, "Well, just have them drink bottled water," but that comes with issues and expense and microplastics, and so that's just not the solution. And what people do not realize, many, is that we're one of the last countries in the world to fluoridate our water. So most of the rest of the developed world has either never implemented water fluoridation or has removed it. And so we're in this period of time now where there is a shift, and we are seeing some states stepping up and banning it, and there's more discussions around it. Unfortunately, it's become incredibly political, like everything right now. And those of us who have been speaking about this for years before any administration was even present, you know, are getting criticized for that. And so we all need to just take a step back and just look at the data and the science. And again, I'm an advocate for children, and I can't look a parent in the eye and say, "This may not damage your children's brains." I can't, there's no data, there's no safety data. It just really got grandfathered in before evidence-based medicine. And so we really update our practices.
Yeah, so I started to get really interested in fluoride because one of my old mentors that I did research with when I was in college did research on lead and a lot of other heavy metals. And he started to get interested in this fluoride story. And he became, he started to do research. This was like 20 years ago. And he's one of the top lead researchers in that world of fluoride. And he said, kind of echoes what you're saying is like, I think the problem is that not only does it give you very marginal benefit for cavities, there's now good data that especially in pregnant women, that like neonate, like that first 1,000 days, it has a measurable detrimental effect. And I think that is something that can't be argued. That part is like very clear in the research. What's the controversy, I guess, is my question.
Well, there's a lot of industry involved. I mean, I'm sure very similar to the American Medical Association, the American Dental Association does have ties to fluoride manufacturing. I mean, why hasn't the ADA come forward and said, "Gosh, I think we got this wrong. Let's reassess the data." It's really disheartening and disappointing. I think there's a lot of money behind it. So some people may not know, where does the fluoride come from? So the fluoride in our water comes from the phosphate fertilizer industry. It's called hydrofluorosilicic acid. It's a byproduct of the phosphate fertilizer industry. It is considered a biohazard, and it's very expensive to dispose of. But when diluted and put into our municipal water supply, it is deemed safe, okay? And everyone will say dose makes the poison, but here's what they're missing. They're missing cumulative effects. No one is saying if you drink 1 glass of fluoridated water you're going to have long-term effects. This is, the rain barrel effect, if you will. The other issue many don't realize, it's very hard to titrate and keep at an accurate level. And I've spoken to many people that work in municipal water supplies who agree with this. It's a biohazard, it's toxic, they have to wear protective, clothing when they're around it, and again, people say, "Well, but that's in concentrate when it's diluted." But what's the halo effect? So, you may drink a glass of water a day, during pregnancy, and I may drink 3 liters of water a day. The American Academy of Pediatrics suggests pregnant women drink 2 to 3 liters a day. What the data is showing is much over 1 liter of water, you're in danger zone, and there's even some implications that even at a liter or less there can be because, again, we're all bio-individual, and how we
Mhm.
metabolize and detox is different. The other thing that's missing from this conversation is the EPA is ignoring their own margin of safety. So the margin of safety for fluoride, and this was an EPA expert under oath that stated this during that TASCA trial, said the margin of safety needs to be 10x. Okay. We currently fluoridate at zero point 0.7 milligrams per liter. Most of the data will show at 1.5 milligrams per liter, there is significant concern. So the pushback is people will say, "Well, that's twofold of the concern." Although there is data to show at zero point 0.7, there's concern too. That tends to get buried and not discussed. But even let's just say at 1.5 milligrams per liter, that's our area of concern. That is nowhere near a 10x. A 10x would then mean we need to be at 0.15 milligrams per liter, and we're at zero point 0.7. And this is to protect vulnerable populations. This is why the EPA has a margin of safety. Who are the vulnerable? Pregnant women, infants, and children. And with fluoride specifically, people with kidney disease, people with calcium and iodine deficiencies, people with genetic polymorphisms, and people with fluoride sensitivity or allergy, and that does exist. So again, it seems common sense to me, but I feel like we've lost common sense in a lot of topics these days, and at the very least, again, I think we should just pause and say, it's a risk v
Yeah.
benefit issue, right? But we're not doing that, we're pushing forward, and people are very resistant to even having the conversation, and if you have the conversation, you're lumped into the group, just as I lumped those people as I sat there in that audience and listened to the debate, I was judging. Um, and so it takes an open mind to look at some of these things and to admit we got some things wrong. But I think we should look to other countries, and there are other ways that we could prevent decay in our population. And water fluoridation is a failed practice. Cavities and gum disease are the top chronic disease in the United States. And we've been fluoridating our water since the 1940s. So by the time someone's an adult, between 80 and 90% of the population have suffered from dental decay. That is not impressive to me. So I think we can do a lot better, and this comes with education. in programs that actually work, and so I'm hopeful that being on platforms like this, thank you, it just helps educate the public to advocate for themselves more, and it will be just interesting to see where this goes.
Yeah, I think that's the thing. I think once you realize what I think taking the politics out of it, I think it's pretty clear that at least in certain populations, this can be, like you said, vulnerable populations are what we worry about. Yes, there's probably an issue in the general population. I mean, based on what we know, but especially those vulnerable people. So tell me about what fluoride does to the microbiome and oral microbiome, and in general, what we should be doing for our oral microbiome.
Yeah, great question. So this is the other controversy. So if you just do not want to believe the neurotoxicity aspect, for some reason, when you sometimes say the word neurotoxicity, people just get turned off by that. I don't
Mhm.
know why, but let's just talk about the gut microbiome and the oral microbiome. So there's copious research to show that we know fluoride is antimicrobial. And dentists will tout that as a benefit, but here's the thing, it's not selective. So it is killing off potential pathogenic bacteria, but also our commensal and healthy bacteria. And then imagine ingesting that. So what is it doing to the gut microbiome every time you drink water, or you cook with it? And this is going back to the halo effect, which I didn't finish that thought. So you may drink a lot more water a day than I do. And I'm also cooking with it, arguably showering and bathing with it. I also eat a lot of ultra processed foods, which contain fluoride. If there's water in the ingredient, it's probably fluoridated water. They're not using reverse osmosis in these
Mhm.
factories. So ultra processed foods, a huge area where we can get fluoride exposure. Many people do not realize pharmaceuticals is one of the top places we get fluoride. So they add fluoride into many pharmaceuticals because it helps with bioavailability. Prilosec, SSRIs, if you can believe it. So that's interesting. Plus, in children, are they swallowing their toothpaste? Are they swallowing their mouthwash? All these fluoride varnishes and things. There's so much fluoride exposure in the general population. So, what is that doing to the gut microbiome? And we all know, I hope by now, how important the gut microbiome is to every aspect of our health. And so that is a concern. And what can we do to boost our microbiome? So it's a lot of the same things that we do for the gut. So we want to be eating prebiotic rich foods, okay? Eat the rainbow foods. We want to be eating fermented foods ideally daily. We want to be avoiding strong antimicrobials and antiseptics. So that really potent mouthwash that burns your mouth, that is carpet bombing your oral microbiome. And there's data now to show patients that use these strong rinses are more likely to have cardiovascular issues and increased blood pressure, among other things. And why is that? Nitric oxide is a molecule that is produced by bacteria in the mouth, nitrate reducing bacteria, and they live on the dorsum of the tongue. And so, if you are eradicating them, you will have less nitric oxide, and that can affect vasodilation. So people will have sexual health. I mean, it can lead to erectile dysfunction, as well as microbiome imbalances and then cardiovascular issues too. So that's a big deal.
What are the mouthwashes that people should be watching out for?
Yeah, so I would say like Listerine and Scope and chlorhexidine, actually, which is often prescribed to patients. You could argue there's a time and place for some of these things. So let's say you have severe acute periodontal disease. So if there are these virulent pathogenic bacteria that we're really trying to eradicate or reduce, maybe some guided therapies with some of these stronger agents, but from a daily use standpoint, absolutely not. It should be used for a very short time in a very targeted protocol. But the problem is a lot of people will say, "Well, I need it. I have such bad breath." And then I would say, "Well, that's your body trying to tell you something." So our breath shouldn't be foul and bad. That's a sign of an infection. That's inside inflammation. That's a sign of dysbiosis or decay or periodontal or gum disease. and those are things that should be addressed. So, if you find you have to have this to mask how you feel your breath is, then I would encourage you to dig deeper and to see what's going on. And we know patients with gum disease and patients with periodontal disease are much more likely to have downstream effects that impact other organ systems like Alzheimer's and dementia and fertility issues and cancers and diabetes and autoimmune issues and obesity. And why is this? It's because the microbes in our mouth, especially if your gums are bleeding. So think of bleeding gums like leaky gums, like we talk about leaky gut. So now there is a point of entry for the bacteria in your mouth to get into the circulatory system and the lymphatic system and catch a free ride, and they can end up in your brain, in your heart, in your uterus. And some of these bacteria are linked. There's plenty of data to show they're linked to some pretty significant outcomes. They found a study out of Harvard found 94% of Alzheimer's patients who passed from the disease had oral spirochetes in the brain. And these cause neural inflammation and amyloid plaque. And so correlation is not causation. And we're still unpacking a lot of this in the literature and research, but clearly there is a connection. They're finding F nucleatum in tumors in colon cancer and pancreatic cancer and breast cancer too. And so that whole saying, don't look a gift horse in the mouth, the mouth is the gateway into the body. You cannot have a healthy body without a healthy mouth. I also want people to be thinking that the mouth is the gut. So if you're super into gut health, you have to be focusing on your oral health too, because they're bidirectional and they influence one another.
So that's a great segue because if someone's watching this and they never heard about this before, because I know there are going to be people who haven't, what are the top 3 things or 5 things that they should be doing for their oral health to kind of not be in that position where they have a leaky kind of mouth?
Leaky gums. So I would
Gums.
say foundational is nutrition. Believe it or not, everyone thinks if you have gum disease, it's from hygiene. It's not true. That's one component, but I actually push it pretty far down. So vitamin C deficiency, B vitamin deficiencies, micronutrient deficiencies, zinc can all lead to bleeding gums. Also, fluctuations in hormones. So, if anyone's been pregnant, pregnancy gingivitis impacts 75% of women. And then again, it hits us up during perimenopause and menopause. And we can unpack hormones a little bit more down later in the episode. So, just making sure you're nutritionally optimized and all the things that I know you speak of on your platform. What's good for the body is good for the mouth. Okay. And if you don't know, test, don't guess. I think is really important, and particularly fat soluble vitamins, vitamin D, vitamin K, vitamin A, and then I would argue the minerals too. Magnesium, calcium, phosphorus. All of these are incredibly important. The next I'd say is honestly your saliva. We do not appreciate our spit enough. I find it to be the golden elixir of the body. It has immune cells in it, digestive enzymes, of course, this beautiful microbiome, but it also has minerals, and it's those minerals that exchange in the teeth to remineralize and demineralize your teeth. And if it's out of balance or if you're dehydrated or mineral deficient, you will not be optimized. And this is why women who hit perimenopause, menopause, we have estrogen and progesterone receptors in our gums and in our parotid gland, and we do tend to get xerostomia or dry mouth, and a lot of women during these times will experience dental disease. And they're kind of shamed, like you need to be brushing and flossing more, when really maybe it was a hormone replacement therapy conversation, which I'm so happy this is more front and center now. So optimize nutrition, hydration, I would say also nasal breathing. So we know that mouth breathing is detrimental for the entire body, but particularly the oral microbiome as well. And why is this? It dries the mouth out, as we just spoke about the importance of saliva, but it also will alter the pH. And pathogenic bacteria love acid. And so when you mouth breathe, when the mouth becomes dry, the pH lowers into a acidic range. And this is where pathogens thrive. Okay, so we really want more neutral or alkaline pH in our mouth. and it's truly acid that causes disease. Everyone thinks it's sugar. It's really acidity. It's acidity that's leaching the minerals out from your teeth. And the acid will come from these pathogenic bacteria metabolizing and feeding upon sugars and flours and fermentable carbohydrates in the diet. And then as a byproduct, they release acid. So I would say nasal breathing is incredibly important, and airway is a whole separate topic too, but there are airway trained dentists that can help you unpack how to get back to nasal breathing if you are a mouth breather or if you snore at night. And many people get a little defensive about this, but please be open to exploration because it will really improve your health span and your lifespan if you nasal breathe. And then lastly, I would say is hygiene. So, flossing, I think, cannot be overemphasized. Patients who floss, they do tend to just be healthier systemically. This is where we keep our gums healthy. This is where we prevent leaky gums. This is where we prevent pathogens from building up and creating an ideal biofilm. So that's what plaque is. Why do we brush and floss? We're disrupting the biofilm. That's all we're doing. Now, the bummer is the biofilm always comes back again, but it will come back in a different order depending on what you're eating. So if you're eating meat and vegetables and fruits and whole foods, things from farms and not factories, you will probably have a pretty healthy biofilm. If you tend to eat more fermentable carbohydrates, ultra processed foods, chips, crackers, granola bars, fruit snacks, you're probably going to have a less ideal biofilm and that one that is more damaging too. So this just goes back to eating whole foods and kind of the basics, the pillars of health.
Is there something that in terms of toothpaste, mouthwash, kind of that kind of thing where, we could be doing things like and do you believe in, like, mouth taping, for example, to help people nasal with their nasal breathing?
Yeah, we can talk about that one first. Yes, I lip tape or mouth tape every night. I do like people to ideally have an airway screening before they jump to it, especially in kids. So the data and the protocols show at the age of 3 and above, you can mouth tape a child, but please don't mouth tape children without proper screening by an airway trained dentist or maybe an ENT, just in case there is true obstruction. With adults, we have a little more leeway. So there is something called a lip seal test, and essentially, you can keep your lips closed or tape your lips and just time yourself. And if you can breathe through your nose for 3 or 4 minutes without feeling panic, like sympathetically overdriven, you can mouth tape. And what I say to people is just start small. So just put it on for 15 minutes while you're prepping dinner. Put it on while you're watching a show and then put it on while you watch a movie. And if you can tolerate all of that, you can mouth tape overnight. And I will tell you, my sleep scores are so phenomenal when I keep my lips closed. I feel better. I'm more rested. And there's data to back this up too, okay? But all you need to do is have some sort of wearable and test it and see what do I look like without taping my mouth shut versus taping it, and I think you'll be very interested if you are a mouth breather.
What's your brand recommendation for this? Because 'Cause I'm, totally up for trying it, but I haven't ever done it before.
Yeah, sure, sure. So to ease into it, there's a brand for kids, there's a brand called Myotape, and I like it because it's almost like a girdle. It just goes around and it's open in the middle, okay? I use a brand called Hostage Tape, which people don't love the branding, but they were going for, like, the liquid death kind of,
Yeah,
you
yeah.
know yeah, and they're very successful as a result, and it's essentially fabric, so it's breathable, and, that's what I use, and I love it, and I use it every night, and it's changed my life, and finally, I got my husband on board. It took years. He had to hear it from someone else on a podcast, of
Yeah, of
course.
course.
Yeah,
How do you buy hostage tape?
on the website. I'm
Okay.
sure they're on Amazon too.
Yeah.
Yeah.
Yeah,
Yeah.
okay, cool.
They're really
That's
I know the founders too, they're great. So we like to support good
yes.
people too, right? So they're really cool. So yeah, I would say try it.
What about in terms of, like, a toothpaste or any
Mhm.
kind of, like, oral, care? Is there something that is better than others?
Yeah, so let's start with floss. So unfortunately, a lot of floss does have PFAS and Teflon on and forever chemicals, and even the ones that some of that are marketed as clean. Be cautious. I know more about this than I should. So their true clean floss is silk or bamboo. Okay, so you can look for that. With
What's a
kids,
brand that you love? Do you have a brand that you love?
gosh, I really don't.
Okay.
I mean, I'm coming out with my own silk floss too,
There you
but
go.
until then,
Yeah.
I can't think of the brand. I just get it on Amazon, to be honest with
Okay.
you.
Cool.
But, make sure it's not coated with fluoride or flavoring, just plain. And then with kids, I just like the little floss sticks. Again, just plain, uncoated, not fluoridated. I also like water picks a lot too, and especially as we age, we have all get a little gum recession and a little bit of bone loss. And so flossing isn't quite removing the biofilm like we want it to. The floss is just cleaning the sides of the teeth, but we all tend to have these little pockets as we age, even if you're incredibly healthy. And that's where the water pick can really help as we age. It also helps with people with big hands that can't physically floss very easily, but also sensory humans. Humans that just are more orally sensitive, the water flosser can be more captivating and tolerable, even in the child population, the pediatric population. What I do is I floss at night, and I'll string floss one night and water pick the other night, and I alternate it that way.
Okay.
So, toothpaste, I mean, this is a personal preference. So, of course, there's fluoridated toothpaste. I do not use fluoridated toothpaste. My kids, I have 9 and 11-year-old girls. They're turning 10 and 12 actually this month. They've never used fluoride. Their teeth are beautiful. They never have had decay. I feel very fortunate, but we've been very on top of diet since they were born. So we use hydroxyapatite, and hydroxyapatite has been around for over 50 years. It is the gold standard in countries like Japan, very prominent in South Korea and Europe. And what is it? It's biomimetic. So our enamel is primarily made of hydroxyapatite, which is calcium and phosphorus. Our bone has a lot of hydroxyapatite in it. And so this is a biomimetic toothpaste. And since I started using it clinically in my office, it's been about a decade. I've been so impressed with how much improvement I see in my patients' oral health. One, I think because fluoride's antimicrobial, so hydroxyapatite doesn't have that antimicrobial effect, so it really will help better support the oral microbiome, but also it remineralizes better than anything I've seen clinically. So if you have areas of demineralization, or a lot of parents are trying to watch cavities or arrest them or even remineralize them if they're really small, I think this is the way to go. So there's microhydroxyapatite. I don't find that works as well. The particle's too big, so it tends just to coat the outside. It's good from a preventative measure, but it doesn't really help remineralize to the degree that I like to see. And then so there's nanohydroxyapatite too. There's a lot of bloggers speaking about concerns with the word nano and nanohydroxyapatite. It's very frustrating. This is only a United States controversy. I speak to researchers in dental materials all across the world, and there's just no data to support it. So the SCCS in the EU, the Scientific Committee for Consumer Safety, has tested it and shown it dissolves in solution in saliva and stomach acid in minutes. It doesn't cross epithelial layers. It doesn't cross the blood-brain barrier, etc. And so that's what my family uses. That's what I recommend to patients. But again, it's always a personal choice. I just recommend that patients do use something with an active ingredient. So some of these DIY toothpaste, they're not doing a whole lot. And it's not that I don't love the idea of it, but if you're at all eating the modern diet, you need something more. Now, if you're like strict paleo or carnivore, I'm not advocating for any diets. I obviously want less ultra processed food, but
Mhm.
you maybe can get away with it. But that's not the reality for most patients, certainly not a lot of kids, right? So we do need something with an active ingredient in it.
And is this something that people can buy, like, easily buy?
Yeah, yeah. I mean, full disclosure, I've created my own line and my own brand. That's what I generally recommend because I
Yeah.
poured heart and soul into it. It's called Feed Your Good Guys, and
Okay.
we added prebiotics and amino acids to actually modulate and boost the microbiome too. And then it also has the hydroxyapatite, and we took out all the emulsifiers and all their surfactants. So it's really an oral microbiome supportive toothpaste because all of those other ingredients too, the essential oils, the foaming agents, they can disrupt the microbiome. Um,
Interesting.
but other than that, the ones that I like Risewell Pro. It has to be the Pro. I like Boca. There's a company called Knobs, Nobs. They're tablets. They're excellent. So those are some top brands that I recommend to people.
What about, like, my son loves his whitening toothpaste because he feels like his teeth are super white and he wants to, like, all he's, like, obsessed with keeping them white, and I know that that can't be good for you.
Mm-mm, it's not. So it does wipe out the microbiome, and then over time, it can cause nerve sensitivity and nerve damage. So all of the hydrogen peroxide and the bleaching, I mean, I need people to realize anything you put in your mouth, it's altering your microbiome. It could be a filling, it could be a crown, it could be food, it could be the toothpaste that you use. So just like we want to think about what's on our fork, we want to read ingredients and just be mindful. So I don't recommend a lot of intense bleaching. Plus, a lot of those toothpaste, they tend to be abrasive. So there's
Yeah,
something called the RDA, the Relative Dental Abrasivity Index, and it matters a lot. So this is why I don't love charcoal toothpaste. It's extremely abrasive, and so it's actually wearing away your enamel. And over time, you can get sensitivity. It aesthetically doesn't look good, and you can get cavities, and then also, it can lead to nerve damage and then root canals, like, we don't wanna go there.
yeah,
So, I might suggest he backs off on it a little bit. Here's the problem, we are over inundated with Hollywood and
yeah,
filters and veneers, so we've lost sight of what's normal and the
yeah,
normal tooth shade. People just want teeth that are so, so white, and I want everyone to do what makes them happy, but just know what the risk could be to
yeah,
achieve that, and that is just not a natural state of tooth shade, what many
yeah.
people are trying to achieve.
No, I think that's absolutely right, and I knew that was the case, but I didn't really know, do you like when people kind of rotate in and out, or what do you recommend when people want to have maybe teeth whitening in the office, or what is it just rotate it in and out?
I would rotate it, there's a brand called Luminu,
Mhm.
Lum we can put it in the show notes,
Yeah,
Naux,
send it to me, yeah.
I'll send it to you. So it's a more gentle herb nutraceutical based whitening strip. So it will lighten, but often not to the degree people want. So yeah, rotate in. If you really love your bleaching toothpaste, just use it a little bit less. Maybe just use it twice a month.
Yeah,
If you really love hydrogen peroxide rinse, just do it. Don't do it every day. I
yeah,
mean,
that's not
you're going to have issues if you're doing that long term, I think. Yeah.
okay, so I could talk to you for hours and hours, but I want to wrap it up with a question about perimenopause and menopause. I think, give me your rapid thoughts about what people in women in perimenopause and menopause should be looking for. What should they be doing? What should they be expecting?
Mhm. I think first is the education. I'm so happy there are more platforms speaking about this and normalizing it and show that we can be advocates for our own health. You know, when our hormones change, our microbiome changes. There's data to show that gut microbiome changes, the oral microbiome changes. We have shifts in estrogen and progesterone, and that can lead to tissue fragility. So you may have more gum disease. Teeth can shift. It affects collagen. So a lot of women may experience like joint pain, TMD,
Mm,
and unfortunately, I this word is so overused, but women get gaslit. They're just like, "Well, you need to brush and floss more, come in more regularly for cleanings." And it's so much bigger than that, where we get dry mouth because it impacts our salivary health too. And so imagine if we worked upstream. And so we were educating women as they approach those years. Let's test, don't guess. Let's get some hormone panels run. Let's see where you're at and stay ahead of it and strategically help you through this period, and I think we would avoid a lot of these oral health issues if we stayed ahead of it. And then women that might be actively in perimenopause or beyond and are having oral health issues, it's never too late. It's never too late to try to optimize yourself hormonally. It is hard to find providers thinking this way, of course, but this is where I really suggest you try so hard to advocate for yourself and as best you can find people that will support you instead of just masking and shaming and brushing you off and like really try to help support you during this journey.
Yeah, I'm so glad you mentioned that because I think women often feel like everything is falling apart. Like they keep like almost everyone will say like, I don't know what happened. I got into perimenopause and everything's falling apart. Like they kind of blame their own selves like for the things that are happening to their body when it's actually like if you understand, it's not your fault per se, and there's a lot of things you can do proactively.
Yeah, and of course,
So
I know you speak of your platform. I mean, resistance training. How does that help
yeah.
oral health? Of course, it helps oral health. I mean, it helps everything in the body. It's gonna help your hormones, it's gonna help your immune health, it's gonna help how you sleep at night, how you breathe. All the musculature of the face is really important to find balance. So, it's all the things that you hear physicians speak about. It all ties back to the mouth too.
I love it. Dr. Stacy, thank you so much for being on the podcast. I think we covered in this short time so many topics that I think people will find so much value in. And I think just about oral health, about the oral microbiome, about fluoride, about what not to do. I think this was really exciting. Where can people find more about you?
Yeah. So I do have a website, drstacy.com, and I have a weekly newsletter where I try to dig into these things in more depth. So I know we skim the surface, but I really do unpack a lot of these topics every week. So please look for that. I do online consultations for 13 and below. I do kind of target the pediatric population right now because I'm trying to catch things upstream to prevent issues from happening in this population. And then I hang out a lot on Instagram. It's Doctor underscore Stacy. Doctor is spelled out STACI, and then I'm on TikTok a little bit too.
Oh, awesome. So we'll check you out there too. So thank you so much for being on there. Thank you everyone for watching and stay tuned for all that. We'll put all the things in the show notes as well. Have a great day.